All right. So about us and what we do at Stand With a Girl Initiative. We are a youth-led non-governmental organization, and as an organization, we are dedicated to ensuring that every girl in Nigeria, no matter where she is born or found, is empowered to fulfill her maximum potentials. And our vision, like I said, is that every girl, no matter where she's born or found, is empowered to fulfill her maximum potentials. And our mission is to promote a safe and supportive environment for social, economic, and academic and healthy development of girls. So our objectives span through, to empower girls to make informed choices, to reduce maternal and infant deaths, to increase girls' potential to meaningfully engage in economic and political activities, to increase the focus on adolescent health, especially sexual and reproductive health, which is one of the reasons why we're here today, and also to support members of the community in meeting their education health needs. So just quickly, what we've been able to do over the years with our program reach out to both girls and women, as well as boys and men. So we get that a lot of times. Why Stand With a Girl Initiative? Why not stand with a boy or stand with the men? As much as we work for girls, we also reach out to other people because, like I said earlier, that partnership is one thing that we work towards in our organization, and we ensure that this cuts across even the work that we do. So we work with communities. We're able to reach out to over 5,000 girls, parents, created awareness on menstrual hygiene, both in school, in communities, and just reaching out people. We've also been able to empower women in businesses. We've also been able to provide food items to households, both in Internally Displaced Persons Camp and even during the wake of COVID-19 pandemic. We've also been able to support 36 adolescent girls advocates from across 6 geopolitical zones in Nigeria with knowledge and skills to advocate for enabling policies. And also we've been able to, boost the businesses of 110 women in the IDP camp with support of both funders and even from personal funds of people who saw the importance of empowering women and being able to be ahead of their businesses and even being able to cater for their families. We've also been able to implement the Data Made Simple project in 12 states in Nigeria. And this has helped, other young people to be able to be at that stable of decision making on things that concerns their health, particularly sexual and reproductive health. We currently have 4 girls who are from the Internally Displaced Persons Camp who are enrolled in school under our Stand With a Girl education project. We also have 20 girls who are girl advocates for safe schools working in different communities in Kaduna states to be able to advocate to community leaders and even decision makers on ensuring safe and secure schools. I mean, those are like what we've been able to do over the years, and we still implement projects for girls, for women, for community members, and across all board, just to be able to ensure that no one is left behind, or particularly with interest to the lives of our girls. So quickly, I would like to talk about our Welead. So what is Welead? Welead is a project which is funded by EVOS, and this project's goal is to ensure access and utilization of quality sexual and reproductive health information and services for women and girls in Internally Displaced Persons Camp. Our objective is to strengthen strategic advocacy to relevant stakeholders to influence policies and laws that respect the sexual and reproductive health and right for women and girls. We've also been able to, one of the objectives of this project is to strengthen the capacity of women and girls in the IDP to strategically and meaningfully advocate for their sexual and reproductive health issues. So as much as we want to, do these projects and see that women have access, we also want them to be at the forefront of being part of the solution providers to their problems. So as much as we want them to come out of their problems, we also want them to take ownership of seeing this as a problem that they have, and they are able to come out of it by themselves. So which is one of those things we do that cut across all our projects, so that while we are engaging people, they are also doing it by themselves. It's not just swag seated somewhere doing the project for them, but these people are also involved in what they do and how it affects their life entirely. Our thematic areas for this project is sexual and reproductive health, and of course, sexual and gender-based violence. Now, this project scope is women and girls aged 15 to 34 in Wasa Internally Displaced Persons Camp. So briefly, this is what we've been able to do so far. We conducted a needs assessment on knowledge, attitude, and perception of sexual and reproductive health. We conducted this in the Wasa Internally Displaced Persons Camp in 201 households. This enabled us to, it was a sample size population, but with this, we're able to get data on the state of sexual and reproductive health of women and girls in this community, using it as a case study to other internally displaced persons camp. We've also been able to conduct visioning meeting with 20 camp leaders to gather their support on sexual and reproductive health for women and girls in the same camp. We've also been able to train 30 women and girls on smart advocacy on sexual and reproductive health for women and girls in Wasa IDP camp. We've conducted community sensitization to almost 250 community members. We've also been able to develop documentaries on the stories of women and girls in Wasa Internally Displaced Persons Camp. And these documentaries were used as a tool to inform the public so that they could know these are the issues that women who are in internally displaced persons camp go through and can provide solutions to these problems. We've also been able to strengthen the capacity of 20 camp leaders and 10 young men on sexual and reproductive health needs of women. We saw the need to also involve men in the process, because as much as we want to advocate for women and girls, men also have a role to play in this process. We've also trained an additional 20 women as social mobilizers who went from house to house, sensitizing women and girls to be able to advocate for their rights and to also ensure that they understand the importance of their health and how it can contribute to their development and in turn affect even their children. We've also been able to conduct house-to-house sensitization in this community, which was led by the trained social mobilizers. And lastly, is why we are here today. So it may interest you to know, so what then is the media doing? We've understood over the years that media is an effective tool for communication, and without media, it might be impossible to reach the hard-to-reach people. And while we want to reach those hard-to-reach communities and people who are even at the point of decision-making that affect the lives of these girls and women, it is important that the media is part of our session. Is part of our goal, and they understand that it is important. So it's not like we said, we know that you are experts, you understand the arts and crafts of doing the work you do, but we saw the importance of bringing you on board, even as we partner together in order to achieve a healthy society that will relate to a healthy Nigeria. And that's why we're here today. So without wasting much of our time, after this meeting, we would like to share the slides with you, because we do not want to take your time. We know you have a very busy schedule, and that's why we just want to break it so short about what we do and why do we need projects and why this is important, because it's important that we go out and give out, these messages to people. But media is one effective tool that can reach millions of people in just 20, 30 minutes of talk, and then people get to change over the years by the constant messaging that they hear, so that at the end of the day, everybody is happy, no life is lost. Women are able to exercise their sexual and reproductive health and right. So thank you so much, everyone. These are just picture effect of what we've been able to do, and just basically what we've been able to do over the period of the implementation of this project. This project started last year, and we've been able to do quite a number of things reaching out to these women. So thank you so much, everyone. So while I was speaking, I noticed that my video was turned off, and it will just be exciting. I know that by the end of this meeting, we'd all turn on our videos, but I know that, it's always important that you know who has been talking. And so, yes, this is me, and then this is Ken. And yes, thank you so much, everyone, for joining. Over to you.
Would you be taking questions now? Wonderful presentation. I'm sure a lot of us would be itching to ask questions, but there's room for that maybe at the end of the next session that we'll be having now. So without wasting much time now, we'll quickly invite our communication strategists to take us through the capacity building session.
Okay.
So Shay.
Good morning, everyone. Can you hear me?
Yes, we can hear you, and I'm sure every other person can hear you as well. So, hello everyone. So just before Sheyi comes up for our session, would like you to answer the questions on the pre-test. Okay, great. Thank you so much for joining. Over to you, Sheyi.
Okay, thank you. Good morning, everyone. Thank you, Mr. Ken, and thank you, Mercy. Good morning, everyone. I know that we're going to have a great time doing this today. And, like they've said, we're going to be looking at how exactly are we to communicate this well. Mercy has been talking on how important, the role of media is. And I know that everyone who is here, who is participating in this, knows the role of media and, that role that the media plays in ensuring that issues are communicated to the public, to decision makers, and, what have you. So, Mercy, please, could you help with the slides? Or is it Mr. Ken? Can you still hear me?
Yes, we can. I'm sharing it now.
Thank you. So, apologies, I won't be able to turn on my video at this moment, and it's just so that you'll be able to hear me clearly. My network is not so good, and turning on my video may make it worse. So I'll just, at any point, if I can turn on my video, I will do that. But for now, it's going to be off, but you could enjoy the picture that you see there. That's me. So yes, we're going to be doing sexual and reproductive health and rights, storytelling and messaging for media personnel. So what are our objectives? What are we looking at exactly? I'll be calling us to talk at some point, and we get to also hear our names, as we do this, because I believe that it should be an interactive session because we have media personnel here. Next slide. So what are our objective? At the end of this, what is it that, we'll be able to say, oh, we have achieved, and this is what we learned today. So it's that we want to be able to build the capacity of media personnel with skills to be able to present what sexual and reproductive health and rights in a clear and positive manner. The second one is to become informed about what SRHR issues. The third one is to have a change perception and attitude by publishing stories on SRHR, and to have increased visibility of what SRHR stories, particularly for these women and girls in what internally displaced persons camp. Mercy started by introducing what the project, the Welead project to us and what is ongoing. So, but I feel like before we talk about, we know the role of media, we'll get to that, how the media comes in and what are we expected to do. I'll keep using we because I'm a media person myself. And I think that I didn't do my introduction because Mr. Ken did it already. So maybe at the end of it, I'll just tell you my name again so you hear it from me. But for now, so let's move to the next slide. What is reproductive health, right? We all know that is a state of complete, physical, mental, social well-being, and not merely the absence of diseases or infirmity. And it has to do with matters relating to what reproductive health and how it functions and processes. So it means that, people are able to have a satisfying and safe sex life and they're able to reproduce when they want to, when they choose to. They have the freedom to decide when and how it should be. This is basically about reproductive health. So, but then what are the issues around, sexual and reproductive health? What does it mean exactly? It is important for us to know this, because if we don't know it, there's no way we'll be able to communicate it and know, okay, what is wrong before we get to what the media is supposed to do. So next slide. When we talk about sexual and reproductive health right, now this means that every individual has the right to make choices about their sexual and reproductive health. They will have satisfying and safe sex life, and freedom to decide if, when, and how often to do so. This would also mean that they have access to accurate information. And now this is where media comes in again. Access to accurate information. They need to know. And also access to safe, effective, affordable, and acceptable contraceptive, because it is very essential that they do this. So basically, the way we talk about sexual and reproductive health and rights is critical. Can you still hear me? Are we still together?
Yes, we can hear you.
Okay, thank you.
Yeah, I'm unmuted.
All right. Thank you. So the way we talk about sexual and reproductive health rights is critical to the successes of campaigns to transform social norms and improve, policies, laws, and to building effective movement. Next slide. Yes, and the next one, as we move quickly, I've talked about this already. So yes, we're here. So now we've come to, talking about storytelling and messaging around sexual and reproductive health rights. Comprehensive and accurate, media reporting on sexual and reproductive health rights has never been easy, because it comes in with a lot of myths and misconceptions. And I would like to hear from you, as media personnel, could just give one. So what is it that, when you want to talk about it, sexual and reproductive health, or the perception of the people around? I have worked with a radio station. I know what it means to say, okay, you want to talk about sexual and reproductive health, especially in Northern Nigeria, what it means, or how that people would want to perceive it generally. So what are the, what do people say about it? What do you think about it? What are those means and misconception that you think, that is always like a restriction for media personnel, or you want to share this, but it's that, people around will feel like, oh, this is what you are saying, or is that you want to start promoting this, you want to start promoting that. So I would like to hear from us, just one thing, you could just share with us. Yes, I think we'll start from Lois. Thank you. Just say your name and then we go. Thank you.
So you can unmute yourselves if you want to speak. Thank you.
Okay, looks like
Hello. So can I
yes.
say something?
Sure, you can. Please go ahead. Your name first, and then how you want us to address you on this call, and
Okay. So good morning, everyone. My name is Adirayo Senamyomotosho, and I work with Citizen FM. But before that, I used to work with a radio station in Ilorin, Royal FM in Ilorin, and I used to cover the health beats there. I just volunteered to do it because, like you said, when it comes to sexual and reproductive health, when it comes rights, when it comes to health issues, we don't like to talk about it. We often, there's a, what they call it now, there's a, there's this, some sort of silence that we agree to in Nigeria to keep some things left unsaid. And yet, we have issues around it, and we just expect those issues to just evaporate or resolve themselves, but it won't happen. So at some point, while I was in Ilorin, there was a company called Honey and Banana. They came up with a show about contraceptives. And so all I had to do was get a doctor that, handles sexual and reproductive health issues into the studio to enlighten how to use contraceptives, to talk about it really in a radio-friendly manner. Those were the expressions that they used. And so week after week, we'll do that. And one of the observations I had then was that it's only men that call in on radio stations to, make any contributions. Women never called in. And even till now, it's been a big issue. So while on our end, we're willing to educate and enlighten the people about sexual and reproductive rights in a radio-friendly manner, we didn't get enough, feedback or support, because most people still prefer to just go to a pharmacy or go somewhere hidden, again, codedly, do whatever it is their business is and move on. So that was I just thought to share that sometimes the media house is willing to do the right thing, even going into the communities, but you don't get the support, or you don't get the necessary feedback from people, to do that. So thank you very much.
Yeah, thank you so much for your contribution. And that was really powerful. I mean, you just took us, a step ahead of where we're going to, and we're going to get there. So thank you so much for sharing that. And it's truly important to point that, at some point, there are people who want to share the story, but you don't have the support of the people. So how exactly do you go about it? They say that, doing the same thing over and over again and getting a different results is something else. Let me not call it what it is. Yeah, so we have to look for how exactly do we need to put this message to ensure that women, we're able to reach women, also get them to call. I agree with you where you talked about women not even calling into the program when you have to talk about sexual and reproductive health. You hear men do this, the society and all of that. Yes, but however, we must continue this work and look at, the best way to do it. And that's why we're here, because there are people who need to know. There are people who we need to, their voices are not heard. So we have to ensure that their voices are heard. And it is when we raise our voices that we ensure that, their own voices are heard. Women in in IDP camps, girls in IDP camps, if they don't have this information, if we're not, reaching out to decision makers, policy makers to know what the problem is and how they need to implement certain policies to ensure that the lives of women and girls, get better, will not be able to. The media role in advancing sexual and reproductive health is fundamental to respecting and fulfilling women's human rights, because it is a right that women and girls have. And so they should be able to, get that. Next slide, please. And so the media has that ability to be able to, send out information like we know, and it serves as a source of information for the general public, to policymakers. And we know that the media is serve as information providers, and the mass media is able to, inform, educate, entertain, and what have you, so that people, get this information. And as you do that, I like to see this as a way that you're making people get accurate information, as well as also telling, policy makers, decision makers, what they need to do. It's a big job that you're doing. It's not just, one thing, but it covers a lot of, aspects. Next slide, please. For those who are yet to talk, you will still talk, because we'll get to that place where we get to talk. So it is important for, media personnel to ensure that the messages and images that are communicated about sexual and reproductive health rights do not contribute to the marginalization or negative portrayal of the cause that we're promoting. And which cause are we promoting? It is sexual and reproductive health right. Particularly in this case, we're talking about for women and girls in IDP camps. So, and that would lead us to the next slide, which talked about, we're going to look at what are the ways at which, media personnel, get to present this message, send out this message that sometimes it looks like, oh, it's not really it, or this is wrong, or this is not what it's supposed to be, and there are no responses. Next slide. What is it that, we're supposed to do? Well, we need to know that it's important to communicate rights-based and non-stigmatizing information. I'll give you an example right now. So on right-based information, you know, saying that, okay, sexual and reproductive health rights is this, but you're saying, oh, it does not include this. It means that you can only use condom. You cannot you know, go and get what you cannot get, or you are trying to say that, okay, I want to give you, this is okay, you can get, for a person, you can get what, condom as a woman, but you can't what, get IUD. You're trying to tell her that. And then it's a right that she can access that. And she needs to meet with what, with you know, a service provider who will tell her the right thing for her to use. But already you've told her on radio that the only thing that she can use is condom. And the woman just sit there and believes that that's the only thing she can use, or even tell her that she does not even have the right to use anything at all and at all. Then the other one is what, when we talk about the stigma, right, that comes around it. Oh, when you try to say it already, you're like, it's not like, but it's like, okay, you can just do this. This is a topic that, you know, I know people don't like to hear it, but let's just find a way to just, I know you understand what I'm saying. Let's just say it, you know, just try to put it in. Don't say it the way it is, say it that way. I understand that for media, you know, we have to communicate based on our audience so that they can understand. But however, you know, the way that we present this at times, it's not really good. It's like you trying to say that even though you know that this thing is not white, but it's close to white, is off white, is now that's like a way that, you know, some people try to communicate, you know, sexual and reproductive health rights. You have rights, but you know, there's a limit to the rights that you have. And you have rights to choose what you want, but there's a limit to, because there's one man somewhere that will tell you that this is what you need to do and this is what you need to do. So now these are the issues. And, you know, if I ask us, for example, right now, maybe you've been in a situation like that. It has happened to people before, and you are just restricted and limited to, oh, there's no way I can really present this. I have to find a way to, I'd just like to hear our experiences. I don't know. I see somebody's hand is up. So please, you can go. Is that Lama? I hope I get the pronunciation correctly. I'm sorry. So please say your name before you get into the conversation so I can get the right pronunciation. And if you want to speak, please, you could just unmute and go ahead and speak. Yes, anyone? I'd like you to share your experience. Can you still hear me?
Okay, can you hear me? Hello?
Yes, please. Yes, please, we can hear you.
Okay, my name is Ishioma.
Okay, thank you, Ishioma. You can go ahead.
All right, so, and, you know, talking about the sexual reproductive health rights for women and young girls. And, okay, I work in a radio station where I anchor 2 programs. And I remember one time I had a guest to speak on female genital mutilation. You need to hear callers calling in, mostly men. They saw it as an enabling factor of us saying that women should be promiscuous. That is how they perceived it. Because, you know, talking about the danger, talking about how you're infringing the right of the women. And you hear people saying that this has been in time bound, our forefathers did it. So why are you people talking about it, trying to make the women now to know that they have a right to stand against this? So I think in as much as it's a big challenge, it's a very, very huge challenge, because I even did a report on it, and getting responses for people, even parents, even mothers too, because why? They give them this perception to say that, fine, we are the ones making the rules and regulations for women. Women do not have a voice. So whatever we tell you to do to your daughter, you need to do that to your daughter. And when they challenge that, you hear things of, you will no longer be married. And we know how that stigma, how people perceive it, that, oh, I'm not in my husband's house. And if they ask me what happened, it's because I went against their rule not to circumcise my daughters. So I think it's a huge topic that we know we keep talking about in years to come. So that is one challenge I know I faced. And all through my 1 hour on that show, I was just nodding my head and feeling so sad and bad.
Thank you so much, Isioma, for sharing that. Like you mentioned, you know, the whole stigma thing is a big issue. And even when you're trying to, you know, correct it, you hear people still tell you, oh, this is not it, this is how it should be because it is Africa, it is Nigeria, you have to respect culture, this is what you have to do and all of that. So this happens like over and over again. But you know, as much as it's a big problem that we have before us, we have to look for ways at which we get you know, solution and how to make this better. It's a problem that we all know, and it's obvious that this is a problem, but we have to look at, you know, how to make it better. And I can tell us that one of the easiest way to make it better is, you know, is information, which is the work that, you know, the media does. Next slide, please.
Can I quickly ask a question?
Yes, please.
Okay, so Isioma highlighted a very big issue. That's the female genital mutilation. I know that's not why I know it's not been highlighted so far in what you've been speaking about, but you spoke about child rights and stigmatization. And she did say that, you know, it's one of the biggest conversations that, you know, we'll be having for a long time. Sorry, that's my daughter. Please, I apologize. So female genital mutilation is sadly something that has been around for years. But I like that in this generation, we're speaking about it and we're, what's that word now? There's even punitive measures in place. But one thing that we have not highlighted, on the one hand, you have rights, and on the other hand, you have stigmatization. But you didn't know, where does religion fit into this conversation? When some people tell you that the Holy Book says, you know, that this is what you should do. So it doesn't matter whether you have rights as a woman, but because the Holy Book says this, so therefore you have to do this. Where does religion fit in this conversation? And how do we as media people skirt around it such that we're not offending? I mean, how can we not offend people if we say it doesn't matter what religion you practice, this goes against a woman's right to what she can do or not do with her body? How do we have that conversation? Thank you.
Yeah, thank you so much for your contribution. That's also a good one. Thank you. So on, you know, talking about that or touching on that a little before we move to the next thing that we have, I'd like to say that now this is where the role of our religious leaders also come in. And I know that there is this, you know, do I call it handbook now, that's exists for family planning. Basically it has that of you know, the Christian and then the Muslim perspective around family planning. And what it clearly states is not that, you know, the religion says, you know, do not do this. And this is why we need religious leaders, and that's why media personnel must also engage with religious leaders on some of this show, because, you know, people listen more. Let us not deceive ourselves. This is Nigeria. We know how powerful religion is, how people, you know, what their pastor tells them is what they do, what their imam tells them is what they do. And, you know, once they just get it, that's it. So that means we need to look for a way to bring, you know, these religious leaders who are themselves informed. You know, they know about this and they can talk about it. We have religious leaders around us who know the importance of this. They can talk to this. So that means there's a need to have that balance when you get to invite experts, guests on the show, and you want to talk about sexual and reproductive health rights, or say you even want to talk about, let's take, you know, a part of it, say female genital mutilation. Now you could bring religious leaders on board, let them talk about it. When people hear them say it, you know, religious leaders, traditional leaders, when they say it, the people accept what they say more. And that way, you know, we get to have that balance. Because like you mentioned, a lot of people, you tell them, oh, write this, but then what does religion say? They will tell you, religion says this. A lot of people hide under religion because they use religion to, they interpret what, you know, is there in the holy books to just fit into their own situation. Meanwhile, like a lot of times they could be wrong. But when you get, you know, people who are well informed, religious leaders who are well informed, talk about this, they will be able to guide the people better. We'll get to this as we go. So we've talked about, you know, stigma and how that it creates a negative view of an issue, just like we've talked about. Yeah, next slide. So when we talk about, you know, right-based information as well, what does it do? It empowers rights holders, you know, that's the women and the girls. It also engages stakeholders and it promotes human rights. When we keep talking about the rights that women and girls have, we also engage, stakeholders that, oh, this is it, this is what it's supposed to be for women and girls. Next slide. I'll be a bit faster so that we can have more time to interact. So for girls and women, right, sexual and reproductive health is not merely the absence of disease like we established at the beginning. It is also a challenging period where they become self-aware of their, SRHR needs, and they have to rely on family, peers, school, health service providers, and social media platforms for information and all of that. And when they don't get the right information, that's where, the problem comes in. You meet people and they tell you, oh, I tried out this, or I got pregnant because I didn't have the right information. I have so and so issue that I'm dealing with because I did not have the right information. Next slide, please. So adolescent girls and young women, right, need to make informed decisions about what and have right information about their sexual and reproductive health, because they get to experience body changes and they become self-aware, and it's like a difficult and sometimes confusing point of their life, like I mentioned. Next slide. Now we're getting to where we're going to. Why is this important? Sexual and reproductive health right remains important to the development and good health, because the right to sexual and reproductive health is critical to sustainable development goals. And it contributes to the country's economic growth, gender equality, and, the overall good of everyone in the society. It's very important, and that's why we must talk about it for women and girls, especially those who are in IDP. Next slide. So now we're at the role of media, right? The mass media in Africa has an excellent potential to promote good sexual and reproductive health outcomes through consistent coverage. Yes, I know there are challenges, but one of the easiest way, again, I said, to put out these messages is using the media. And because the media has the ability to, pass this information in a timely manner, accessible manner, and so that the general public and even policymakers, get to know this. Next slide. Poor sexual and reproductive health is a major problem in developing countries like Nigeria. However, media often fails to prioritize sexual and reproductive health rights issues or report them in an accurate manner. We talked about how that the media is trying to put out these issues. That's the work that you do. But there's still a lot of people who do not do this work. There are a lot of people who do not cover this, who do not say it the way it's supposed to be, because they do not want to go through these challenges that you go through. And so for that reason, they just put it aside and don't talk about it, or for certain reasons, they feel like, these rights should not be spoken about, or we should not discuss them. But what exactly do we need to do? How exactly can we make it better? Next slide. And that is why, we're here to talk about it and see what best way should we do to ensure that, this is better. Now, we need to closely follow up and seek information on the process to highlight in our media, blogs, and, what have you. Because there's no way we can give out accurate information when we don't have information ourselves. So we need to keep finding out. And that is one thing that, we're doing here. Now, your relationship with Stand With A Girl initiative gives you that access to, oh, you need information about those women in IDP camp. Oh, this is going on with them. You can always get it from what Stand With A Girl initiative. Now, we need to also look for previous reports on, on what has been happening about sexual and reproductive health rights, or okay, what has been said before, what is the right, what was the agreement, what was signed, and so that we're able to hold policymakers and decision makers accountable for, their promises on this. We need to engage women organization, human rights organization, UN Women on how to get this information. I'll give you an example with Stand With The Girl initiative. There are other organizations out there that, you can get this information from. You also seek, national reports and shadow reports. I know that, for people in media is one thing that you have to constantly do, is to research and find out things, and also to engage in meetings. This is very important. When you go for meetings, you talk about it. And now this will just take us to, I'll take us a little to basically how that these issues are responded to at meetings or even on social media. Now, as media personnel, for everybody who is here, I expect that when there is an issue about sexual and reproductive health rights on social media, for example, when everyone is talking about it and they are not saying what it is exactly, they're not giving accurate information, it is your responsibility to be able to, contribute and say, no, this is wrong and this is the right information. Women and girls have what rights to do A, B, C, D. Women and girls have the rights to do this. Women who live in IDP camp also what? They have rights, so these are things that we need to correct, because we should participate in all of this as media, as people who work with media is very essential. And so what are those three things that, we must do? Is to demand for accountability from policymakers and custodians of culture through our, radio. I know for some people, you work with, say maybe government-owned, media stations, and you may not be able to call out governments and all of that. But I think we have a number of privates, and it's important that, you do that. Is essential. Make debates on SRH a key public agenda and demand for action. Make it known. It's not, by the side, so there's this radio show that I used to listen to, and they just talk about, health generally, talk about health of women. But anytime they're talking about sexual and, reproductive health rights of women, is always like in a segment. I know you understand what I'm saying. Oh, okay, it's just like 2 minutes or 3 minutes out of the program, because it's not a main thing to them. They don't want people to talk about it, because they don't want to, go through offending people in your society, in the community, and but then we must do better. And that's why we need to publish. Now, publish stories of human interest by documenting experiences. So for some of these people who feel like, oh, it's not right, it's not this, it's not that, when you go into the community, you meet these women. For example, these women who live in IDP camps, you're able to, relate with them, get their story, get their consent to also share their story, or you let them share their story themselves. People will be able to hear it. Oh, this is what this woman is going through. Oh, she made this mistake, by not doing what she was supposed to do as regarding her health. So now I need to do better. We need to create awareness on women and girls' human rights in relation to what? Sexual and reproductive health. Another thing is what? Media, which we've been talking about over and over again. We need to make reporting SRH, as a core internal responsibility. And that is why we're here. We must make it. I know that there are other things that you report on, but this issue, it's a very critical issue, just like, I pointed out, the people who have spoken also mentioned that. So we need to use our media platforms to talk about this. Is very essential. Next slide. Next. So what are the strategies in identifying, and when, okay, this is a story that you want to write about, how exactly do you identify it so that you begin to talk about it? You know that, oh, this is it, this is that. You go into this and you're able to get that. But before we talk about this, I'll just pause and get to hear from us. So in what we've discussed so far, now, what do you think are the ways, we can get better in framing our message, or trying to, talk on radio, on television, on sexual and reproductive health? What must we do? Who are the people that we need to involve? Who do we need to bring on board? How do we need to make it better so that the society accepts it? The women themselves, can know their rights. Policy makers can know, oh, this is it. Decision makers can know that these are the issues. What are the things that you can do differently as a media personnel, based on what we've talked about so far? Please, I would like to hear us. If Lois is available, Lois, we want to hear you. Can you hear me?
Can I go ahead?
Okay, sure.
Okay, so with everything you have spoken about, one thing that I'm so interested in is getting a human angle side of this report. It's going to go a long way because, like you said, when you interact with the people that go through this and they speak it, that is word of mouth. You are the one hearing from them. They are the one telling you their experiences. And of course, people relate more when issues that affect them what will okay, I'll put it like people like us. When they get information from people like them, they relate more and they accept it more. So I think that's one thing I'm going to take away. And of course, I see myself working with you guys could get more information on that. Because going to IDP camps here in Abuja, I've never gone on my own. I always go with organizations. And it's good that you have work you're doing with women living in internally displaced people that are displaced in their area, and talking about sexual and reproductive health right there is very important. So that's one thing. And also I want to mention something too. Sometimes working in a radio station, because we have how do I say it? There are some terms and languages you don't speak on air, and that can be a challenge sometimes. I'm not making excuse for whoever is trying to not say the right words or call the right names. There are some times that they want you to filter some information, especially when it's daytime. When you're having some discussion daytime, you cannot mention some kind of words on air at that time. But if it's night, you can have that conversation. So sometimes it tends to limit how you want to pass the information out to people. And even though you have a guest and the guest is trying to, dissect it, to mention those names, you'll be the one like giving the signal, like, please, you need to tone it down a bit. But that does not mean you don't want the information to go out there. It's just the agency that is governing the whole broadcasting firm that doesn't want us to use such terms. So that's it.
Thank you so much, Sioma, for that. I like the fact that, you first talked about, you taking the human angle, getting the stories from these women, and people are able to relate more when people share their story. I mean, I'm the one wearing the shoe, I know where the problem is. So I'm able to say, this is it, this is my problem, and I need, a solution. And, it will also encourage other women to get to know their rights and what they should do. Now, speaking on the second issue that you said, I think that I kind of mentioned it earlier when I was saying, I know that there's certain restriction because I have worked with the media before now. And I know what it feels like. Sometimes you're saying certain things, you're not even done with the radio show. Your producer is already sending you signal in the studio that there's problem, or you're probably going to get a query after you're done because you're saying what you're not supposed to say, or there's certain language because of the environment, especially for, honestly, I pity media personnel in Northern Nigeria because I understand how this can be really challenging and it can be very difficult. But however, what I resulted to doing at that point was, when these experts come in, I just hide under the umbrella that they don't understand the radio thing. So they are the ones, and they did it. They made the mistake themselves. Let people hear the truth from them. So that's why I was talking about, bringing the expert to say what the issue is exactly so that they can talk about it. But I understand that you were saying that if you at some point, you won't be the one telling them, oh, so you have to, step it down a little. This issue, you can't talk about it, you can't do this. These are really big issues that, but I hope that we get better, soon, and we're able to discuss these issues freely on radio so that people know the truth and, what they should really get. Thank you so much. Yes, Lois, are you ready for us? We have Osaru. I'm sorry if I don't get your name correctly. You can just say your name before, you go.
Okay. Thank you. My name is Osaro Ehato. So you can call me Osaro. Hello.
Yes, we can hear you. Go ahead.
Okay. Thank you. I've keenly listened to you, and well done on what you're doing. And I pray that it continues to sustain this. Well, on the other hand, the message of sexual reproductive health, it doesn't stop with the women alone. I think most of the contribution have been centered on women's rights and women's reproduction as well. But if you are going to talk about sexual reproductive health and you want to talk about private parts, as it said, private parts. So these are key information, they are sensitive. So we need to watch out for what we're about, who our target audience are, and who are those people who are going to be listening to us. And on the other hand, there is no way we can actually move further if we continue to allow the issue of culture and religion to dominate our discourse. If we don't try to meet the custodian of this culture and religion and talk to them that this is what the right is, irrespective of what your culture is. I know it's not an approach that takes an immediate change. It's a systematic approach, and it's a multi-sectoral thing. You can't take away justice from this at the end of the day. If someone is abused, or if a lady is abused and she's seeking justice, there are a lot of reported cases of rape that are followed, about 2 now. I know that until now, because of the high powers who are involved, still no justice. So our judicial system is something that we also need to look into and talk about at the same time. How well do people who are offended, the rights of people who are violated, do they get justice at the end? So if we continue to stay this conversation and we don't look at the outcome of it all, yes, we can talk about reproductive health, not just centered on we are going to distribute condoms, you should use it like this and do that, and then we go. And then come back again, do the educative part of it, and then we go. But there are salient information, people who are offended, those who have been abused, they are amongst those people who we are passing this information to, and they want to speak. But for the fact that we don't even know how to channel this information to them, I think information management when it comes to sexual reproductive health is very key, and we must continue to emphasize on how do we pass this information, who are those targets, and then who can we reach out to properly, there are some parents, if you want to, a girl who might be above 18 or a man who's above 18 already, you want to talk to him or her about sexual reproductive health, the parents might not agree because they feel they are the ones who know better and who can talk to their children appropriately. So we need to understand the culture of those people and the religion, and then who are the custodian, who are we passing this information to, how do we pass it to them? It's a big question that we must look at then before we can say let's go ahead and move on the information circulation. Thank you.
Thank you so much, Osaru, for that part of it too. I like that we're really sharing this, and that's why I said let's talk about this. What are the things that we need to do? Amazingly, we are pointing it out ourselves. So I expect that you would also not just talk about sexual and reproductive health, as you do your own radio show, TV show, you talk about these issues that you've highlighted yourself, because it's important that we talk about them. And the media has that role to hold, decision makers accountable, policy makers accountable. You talked about, for example, like rape cases and all that. There have been different rape cases in Nigeria that nobody's talking about. Sometimes you even go on Twitter, you see certain persons trying to say, okay, what's up with this case? What is going on? There's been no news about this case. Nobody has said anything. What is going on? And that's where the media comes in.
Should I react?
Sorry, can you hear me?
Yes, I can. Should I react to that?
Okay, you wanted to say something. I wasn't done. I was still speaking, but please go ahead.
Okay, no. I just wanted to react to what you said briefly, that, media comes in. Yes, media comes in, will set the agenda, but we also need to look at our judicial system. As I said, we can't try someone in the media and get appropriate justice. So if we look at the judicial system, it's a whole bulk of it that we must look into to actualize our objective as well.
That's true. But one of the easiest way to talking about this judicial system, which I was trying to mention, it's that we need to begin to have this conversation on radio or on TV as well, and then call these people, hold them responsible and say, oh, this is it. And then from there we move. So let's, we get back to that. We'll still share more at the end of this so that we don't, so that we can get to the end of the presentation because of our time. So what are the strategies, in identifying sexual and reproductive health story? I know you know this because you're media personnel, you work with the media. Of course, you have to be curious about issues. That's like something important for everybody who works with the media. You need to talk to people. Obviously, it's important. Reading different documents, newspaper would give you an idea, observing what is happening around you, and then scenario building for futuristic. It's very important. So you could just sit down and say, okay, I want to be able to look at now WASA IDP. Yeah, what is going to be the life of these women in the next 10 or 5 years? I want to write about it based on the information that I have right now. And so you're now saying, oh, you're putting it out there. The government needs to do ABC, because as it is 5 years from now, the lives of these women, would have improved, or there's certain limitations that will not make it happen. You need to also look at that. You need to get demographic surveys important. Then of course, international days, we've talked about FGM earlier. We have World Contraceptive Day as well, International Women's Day. These are days to talk about, to look out for, these stories, identify them, talk about them, government pronouncements. What has the government said about sexual and reproductive health rights of women? Has the government, fulfilled promises towards that? And what about get ideas from cultivated sources as well? It's important. Next slide. So we're quickly going to move on by looking at, we've talked about, the strategies involved in identifying this, but how do we develop this story? It's important that we know who you're writing for. Are you writing to, or are you speaking to, for those who write? Are you speaking to, decision makers? Are you speaking to the women? Write for the reader and not yourself. Speak to the, listener and not yourself. Then you need to develop an angle for features, as the story unfolds, as you write about it, as you speak about it. You need to keep your audience in suspense. Okay, what is this exactly? When you're developing such story that, you want to share, you want to speak to people about it. And then how relevant is the story to the person who is, listening to that story or who is reading that story? And you need to create an emotional hook. It's very important. Now you need to bring a face to the fact, who is at risk, who is suffering, who is affected. And this is the place where I talked about earlier, getting the story of this woman, let them share it themselves. What is the issue exactly? Let people get it. When they get it from them, they're going to feel it more. They'll be able to relate better with it. And then, your listener, your reader is interested in their own cause or issues closer to them and not your own project. So you need to talk about, those issues. For example, let's say the radio show is majorly for women in IDP camp. You're talking to, they want to hear about, the issues that they go through, and not issues that, women in some modern society, so to speak, those who don't live in the IDP, go through. They want to hear their own story. Speaking to, decision makers and all that, you need to speak to them about facts and know that, so that they can know, because they will tell you they know these issues, they know some of these things, but it's not been done. You said you're going to do 20, you did 1 and 2 out of 20, and you're saying that you've done it, but that cannot, you cannot really hold them to, if you don't have the facts of what is going on. Use town regional data is very important. Focus on facts, keep your story short, have a good conclusion is very important. Next slide. How exactly do you pitch, your Sexual and Reproductive Health Rights story. I know that a lot of us here, because the media personnel we're familiar with, present to an editor with a thoughtful, detailed, short proposal of the story you wish to share. That's for those who have producers, this is how to go about it, describe what you have. You build also a bank of experts and advocates as sources. Where do you get your info from? Now, a source, of course, you know who sources are. A source is a person, a publication, just any document that, you get that info. Become an expert yourself, because the more you learn about these issues, the more you're able to, present it better. And you cannot learn about it if you don't get into the work, go to this IDP camp to get the story, or get info from organizations like Stand With The Girl Initiative who are working in this community. Next slide. Can anyone hear me?
Hear you.
Yes, we can hear you.
So we're moving
Yes, we
quickly.
can, yes.
Okay. Next slide, please. So that we're able to get to the end of this and would have just a bit of conversation before. Of course, you need to identify gatekeepers. You need to be honest. You need to talk to, you need to talk to survivors. You need to talk to, the users, that's the women themselves, the girls, about what is going on. You also need to be honest, never mislead your source. If this is what you want to share, of course you would get the consent of those women before putting out such stories. It's just important that you get this thing. Is very essential. Can you still hear me?
Yes.
Yes, we can hear you.
Okay.
Louder.
Next slide, please. So next slide. We're moving very quickly now. Well, of course, you would get the slide after the presentation, so you'll be able to go through it yourself and understand some of these things. Next slide. Yes, thank you. So, we have to show interest as well. Sources we want to talk about other things, take you through a very long journey before they get to the issue, but you still have to show interest in what they have to say, and also tell your source your own interest as well is very essential. Next slide. And the next slide, would look at, learn where your records are. It's very important. You need to familiarize yourself with the, learn which records are clearly public, the ones that are not public, the ones that are confidential, so that you know the ones to put out there and how exactly to go about it. So find experts as well. Please, can you mute? So you need to find experts as well. We talked about this earlier. Get people who are in the field, also bring on board religious leaders, traditional leaders that these people listen to. Let them be part of your program, invite them. That way people will be able to, they'll show more interest, and women will feel comfortable to call into the program, to listen to the program when they hear religious leaders speak on, on your shows. It's just important that you do that. Next slide. You also need to develop national sources, because you need to get sources from, information, from different places. So as much as you can, look into national documents so that you can have a bigger picture of what it is that you're communicating. Use the right terminologies. It's very important that you make the most use, if you're not sure about what exactly, next slide, what exactly you're trying to communicate, you can always find out from experts and all that. There's an example in that, in this, you, for instance, you want to say the morning after pill, which is known as the emergency pill. It should not be confused with an abortion pill. The moment you mix the two together, there's going to be a problem. So it's just good that, you find out these things, do research yourself, find out from experts, and also gender sensitive. It's very important. Journalists should use gender sensitive and gender inclusive language, which helps in ensuring that, the journalist reports in a way that is appealing to both men and women. Avoid gender stereotyping and treat men and women equally as source and subject of a story. For instance, you cannot have only male subjects talking about abortion without including women. So this even comes to where you're bringing in your experts and all of that. Now, there's even a need to have that balance. Because, okay, sexual and reproductive health, right? And every time, it's just a male that you are bringing to talk about. There are females who are experts too, bring them on board. We have, religious leaders who are females as well, bring them on board, let them talk to these people. It's just very important that also the language that you use while addressing this is very important. And at this point, I would also like to say that when you talk about the sexual and reproductive health rights of women, also know that's what you're addressing the men as well, because men are involved. I mean, women don't just get pregnant. So it's that we have to involve both parties, get everyone on board so that everybody knows what is going on. Next slide. The use of data, I think I've mentioned this. You have to keep putting numbers, behind your story. Is very important, and it will help people relate more with what you're saying. And also connecting the dots with evidence-based data would get reaction from policymakers and influencers, as well as custodians of culture. You know how that, you have data, you're saying, oh, even the holy books actually said this and this, and you have this data from this, said this. So that way you're able to, get the acceptance of the people that you're speaking with, and they're able to listen to you better. So how do you spot, sexual and reproductive health story? How do you know that this story is sexual and reproductive health story that you need to talk about? Of course, a good nose for story remains the hallmark of journalism. That's very important. You also need to have the ability to recognize a potential story once you just see from something in newspaper, oh, there's something happening on social media. And also the ability to set agenda for audience through topics that are related to sexual and reproductive health rights. You would agree with me, I know we're media personnel, there's a way we can set agenda for certain issues, and that's what people keep talking about over and over again. We set the agenda, and people keep talking about it, and it just leads us to, next slide, that to our own declaration and what we have to do, even as we take questions, other contributions, or what we feel about this before we go. I know I've taken more than the time that we're supposed to spend here, but would conclude shortly. Next slide. As we go, can you still hear me?
Yes.
Yes, we can hear you. Yes, I would like to take
to. Yes, thank you. Thank you. I'd like to take questions before I, just conclude with just a few sentences. If there are any questions or contributions that you have, please feel free to speak, especially for those who have not spoken today. We have Lama, Alamin. Okay, Lois is in the studio and she can't respond right now. She can only listen to us. For La, we have A. Yes, please, do you have questions, contribution? Anyone?
Hello.
Hi.
Hello, can you hear me?
Yes.
Okay, so I really want to appreciate SWAG initiative because over the past year, I've seen your efforts in trying to enlighten women and girls, and including men, on gender-based violence, sexual and reproductive health. I just want to commend the work you're doing. And in the same vein, I wanted to say that there's only so much that organizations and the media can do. I think what we really need is enlightenment, because despite these so many challenges and misconceptions and stigma, you find out that one main issue is the fact that enlightenment is not enough in most areas. For example, the other presenter, she was talking about how women don't speak up. And I find that very weird because this is an issue that relates to women mostly. So in fact, last year there was a rape case where the parents of the girls did not even want to report the case. They didn't want to take it up. So you can see that a lot of enlightenment is needed, because when people do not really understand what to say or how to address the issue, there tends to be silence. Or maybe we live in this culture of fear also sometimes. So also during the presentation, you said something about the media often fails. Well, I can agree with that, because the way the media relates to like societal issues generally, it reflects the kind of societal issues, the kind of societal attitude to these issues. For instance, as a girl, if you're raped, it will be very difficult for you to come out and talk about it because of the stigma. And most of the time you even get blamed for it. So I also want to say that on the aspect of bringing female experts, it is very important, because by the time you bring female experts, people are more open, especially women and girls. They are more open with them and they feel more free to talk to them. I'm not saying men should not be involved, but then I like the way SWAG always like involve men in their activities at the Wasa IDP camp. It's also very good, because when you do not involve men, it's like you're only half of the population along. So at the end of the day, all I'm just trying to say is that despite all the issues we're having, I think more and more enlightenment is an ongoing process, not only maybe when there's menstrual day, that's when we'll go and talk to people, but as often as we can. I think enlightenment is a key issue here for both girls, boys, men, women, parents, and so on.
Thank you so much for your contribution. That was really, really good. And thank you for highlighting that. And thank you for your kind words to Stand With the Girl initiative. So I know we've taken so much of the time, and I know that I believe, there will be like a WhatsApp group after now where we get to discuss further. This conversation never ends actually, on sexual and reproductive health rights and how that we need to send out the information. It never ends, and we'll still continue talking about it even when we have, the WhatsApp group. We get to share more about that, how to go about it, what are the issues, and share experiences from, the work that we have done, or the shows, or some of the challenges, and how we're able to overcome the challenges. But basically telling the stories of these women, putting out, the message to also policymakers in the right way matters, to ensure that we're doing it the best way that you can put it out there. It really matters. And let's not forget that everyone is responsible for this. It's important that we do that. But most importantly, because we have bigger powers, I would say that as media personnel, we are able to put out, this issue so that people are able to hear it. No matter how tough it has been, no matter how challenges it is talking about these issues, we must not stop talking about them, because the rights of these women, they're really important, and we need to talk about them. We need to make these women informed, because the overall the overall good of this is that we have a better society, is that we have a better nation, men and women, everyone is fine and, living very well. But when these issues continue, then there'll be problem in the society. So everyone needs to get on board, male, female, everyone. It's just important that we pay attention to these issues around sexual and reproductive health, right? But most importantly, we need to look at, as a way of, inclusion. Women and girls living in IDPs, it's already enough frustration that they have to live in, internally displaced persons camp. That's why we need to, make their voices heard by putting out their stories, make sure that decision makers hear them through our stories, and ensuring that these women and girls also have, the right information that they need. So I'd like to stop here, but I want us to take this declaration. We'll just say it. Yeah, I know it's going to be rowdy, but please go ahead. Feel free to unmute and say that. Messi or Mr. Ken might have to pursue me out of here because I've spent more than the time that I have. But we'll do this declaration and we go. So 1, 2, go. Can everyone see the screen?
Yes.
Okay,
Yes.
so 1, 2, go. I
I
commit
commit to using
my
my
skills
skills to present
present
SRHR in a
in a
clear
clear
and
and
positive manner.
positive manner. Number
Commit
two,
I commit to
commit to
changing
challenge
perceptions and attitudes
attitudes
by publishing stories
stories.
on SRHR.
R
Third
I
one,
commit
to
to
increasing
increasing
visibility,
visibility of SRHR
SRHR
stories
stories from
through my platforms.
next slide. And now is that time to mention your name. My name is Sheyi. I use my platform to tell positive stories about SRHR. I hope you're able to say this confidently outside anywhere, because that should be what you are doing. Thank you so much for your time.
Yep.
Thank you.
Wow, thank you, everyone. Thank you so much, Shay. This has been quite exciting. I'm not surprised, because when you're engaging with media personnel, you should expect engaging and exciting conversations. So I can truly say it's been quite engaging and quite exciting. So thank you so much for that session, Shay.
About your catalog, you should be very intentional about it. Now, if you associate them yourself with Trend Times or Sheets Web or Green Connect, brand your profile as one. We're going somewhere. If you have a personal business, use your second line and brand it as Green Connect or Trend Times or Sheets Web. I would be perfectly okay if you add Sheets Web to your name, because you are an affiliate, you are an ambassador, and you are being the business. And there's something I normally say. If you're working
So I think that's a voice from someone. Please kindly mute your speaker if you're not talking. Yes, thank you very much. So as I was saying, I said it's been quite an exciting, conversation. And at this point, because we're already running behind schedule, we'll quickly give room for questions, just as brief as possible as we can. Thank you very much. So if you have a question, you just unmute your camera, your speaker, and go on. Anyone, please? Looks like we don't have questions at this point in time. Okay, it's like we've exhausted all our questions and all of that. Okay. Quickly, we'll now take our post test and then see how we can wrap up this session. So I'll be sharing the link to the post test quickly, please.
Please do not leave the meeting. We'll be taking pictures too. So just quickly, Mr. Ken is working on sharing the link to the post test. Thank you all very much. We enjoyed having this conversation, and thank you very much, Shay, for the beautiful facilitation. It was a really impactful session. So while we're waiting for questions, if you still have any questions, you can ask or you can leave them in the comment section, and our facilitator would answer them or reply to them, whatever your questions are related and whatever the session is about. So just give us a minute. Please do not leave the meeting room. We'll be back as soon as possible.
Hello, I can't hear anything now.
So we would try to share the link of the post test. We'll just share it and then we'll take it up from there. Thank you so much, everyone. Sorry about the little technical issue.
If we fill the form, can we leave?
Oh, no, yeah, please. Hello, can you all hear me? No, please, can you try to turn on the video so that we can talk? I mean, see your faces and just take a little picture. Just that, with your kind permission. Thank you very much, everyone.
Hi.
Okay, hello. I think some people left already, but if you're still around, kindly just turn on your video so that we just do yes. Let's see your faces. Yeah, right. Okay. Okay. Just take this one. Okay, so all right. Is everybody's video turned on? Okay, so sorry. I don't know if any of you, the link to the attendance sheet, because that's where you're going to drop your account. Important that if you have not done that, let me drop it so that you
the Google Forms.
Yes, I'm going to drop it now.
We filled it already. I have.
Oh, you filled, yeah, okay, an account. All right, that's fine. I guess that's it. So if there are no other thing, we want to appreciate every one of you for taking your time to be in this meeting. Thank you so much. If you still reach out to you, because why we did this is to ensure that we get support from you and as well be able to work towards reaching out to more number of women and girls, not just even people in IDP camp. As much as we work in IDP camp, but it's also important that we reach out to other people, and also that all that we have been able to identify in the course of this training, the importance of it, human angle story, making sure religion is in the media and everything we had said. We hope that going forward, we'll be able to work more closely with you. At some point, we would have to, reach out to you on, especially on high point days, where we will have some of these women come to your radio stations. As much as SWAG talks about this thing, it's important that these women themselves talk about it by themselves. So we see that it's important. And at one point or the other, we'll be reaching out to you so that you can feature these women in your programs. And
I have a question.
All right, go ahead.
Sorry to hold any other person back. So I wanted to ask you, were you able to do anything for menstrual health and hygiene this past Saturday for women in IDP's camp? Was there any sensitization whatsoever?
Oh, okay. Not directly. We didn't do in the IDP camp. We only reached out to schools. Yes, we only reached out to schools.
Can you come over tomorrow? Let's chat about it. I'm looking for guests tomorrow, so you can come over tomorrow.
All right.
All right, thank you. Sorry to hold everyone back.
So let's continue the conversation, offline.
All right.
Yeah.
All right.
All
right.
Thank you. I still see some people. Let me try and see if I can share the attendance sheets. Hold on, let me try and share the attendance sheet so that people can also. So if you have not dropped your click on this link for your attendance, that's where your account details, you drop your account details. Please kindly do that so that we can come up with this. Thank you so much, everybody. Let me see. Okay. Yeah, somebody's talking. More time, everyone. I'm so sorry, but I think earlier when we say we should turn on our videos, there were some technical issue, but if you do not mind, can you please turn it on again? We're so sorry. If you do not mind, please. Thank you. Oh, yes. Thank you. Thank you so much, everyone. Okay.
So you. No, it's not.
All right. Thank you so much. I mean, if you have not done that, please, we're still up. We won't go out. I mean, we won't end the meeting now until we're sure that everyone has put in their details and also fill out the post test. Thank you so much, everyone. And thanks to our facilitator as well for the session. Okay. Thank you. I mean, if you're done filling the forms, you can leave because if you have another engagement, but while you're still here, you can just drop in your details. This is to also let you know that I will be sharing the recording from the meeting and also the slides that was used by the facilitator, so that if you want to, get what was said, if you had missed out on something, and you can also reach out to us, please, if you still have more questions to ask. Lois, thank you. We will reshare the post test again so you can find it. So apparently what we have in the pre and the post test is the same question. So don't be maybe surprised about the different, the same things that we have. It's just for us to ascertain the level of knowledge gained as a result of the capacity building. Alamin, yes, we have actually come to the end of the meeting, but we just dropped the link for attendance and the post test so that people who were unable to log in can, put in their details. But I think that's why you still have some people online. Maybe they still want to see our beautiful faces. That's why we're still waiting. We don't want to end the meeting yet in case there's somebody who has not written out their details on their attendance sheet. Thank you so much. Okay, attendance link. Okay. Lois, let me, I know there are about 3 links flying here and there, but let me see. Mr. Ken, please, can you drop the attendance sheet for attendance? And Lois, yes, we're sharing it shortly. Thank you. It was okay. Hi everyone, Lois, Ehi, and Mr. Alami. Do we still have any concerns as to the link that was shared? If none, we would like to end the meeting now so that everybody can get back to their work. Thank you so much once again for your time. If there are none, if you have any, just drop it. If you do not have yet, you can still reach out to us. So thank you so much. Like Sheyi said, that the WhatsApp group will be our platform for talking. And then we'll continue on the WhatsApp and via email for our means of communication. Thank you so much, everybody, and have a wonderful time. Bye. Bye. Can you all hear me?
It's like they've gone, it's just that they're listening.
Yes, Mr. Ken.
All right, bye.
Bye.
Thank you. Well done.
Thank you so much. Bye-bye.
Yeah, bye.